before we get into it, as always, please go subscribe to the YouTube. You guys have been helping us grow almost 400 subs a day. It is insane to see this. You guys have been unbelievably supportive of these conversations, the very uncomfortable ones that you have been listening to around euthanasia and MAID and the government corruption that we're experiencing, but also the breakdown of the medical system. And before we dive in, go check out Ketone IQ, Good Living, and Masterpiece. There's a reason why I am able to do so many episodes a day. It's because I am healthy and I am well, and you can be too. The links are in the bio, so go check them out. And without further ado, you guys have been hearing the conversation that has been going absolutely viral over the past couple weeks, which should have been noticed a long time ago, but it's okay. It's better late than never. You guys have heard me talk about coercion. You guys have heard me talk about the medical system failing people. And is it really free will when you're never given palliative care or hospice, but you're only offered MAID? Well, today I wanted to bring on somebody that is near and dear to me, that I have seen her work now for a little while, and we are in the same atmosphere trying to understand how this could happen to a country that is supposed to be one of the, the best healthcare systems in the globe, that people are calling the gold star. Yet we're about to hit 100,000 deaths this spring with MAID, which is medical assistance in dying. You've heard me talk about it. I call it murder. Some people call it euthanasia. Some people call it poisoning. I call it what it is, taking life. So this is an amazing doctor you've seen me talk about recently, Dr. Ramona. She's going to get in and we're going to go through some of these cases that have come out on the Ontario Coroner Report and some of the other reports that, frankly, I get it. It's hard to find. It's long to read. So let us break it down for you. Thanks for being with me.
My pleasure to join you, Kelsi. Thank you.
So why don't you tell people a little bit about who you are and then how you got into this position? Because I'm sure when you started medicine, you never thought you'd be here.
Never. Never thought I would be here. MAID was not even a thing. I think I started med school in 2000. And I'm a family doctor and I care for marginalized persons. So I'm from Montreal. And in Montreal at the time, to stay in the city, you had to have some sort of special kind of service as a family doctor. And so I provided home care. So half of my practice was home care for people who had severe mental health addictions or dementia and organ failure, and people with very severe physical disabilities who couldn't leave their house. So I was taking care of that population in 2010. So I'm in Quebec at that time. You have a select committee on dying with dignity that's struck up by their parliament. And because I had taken care of all these people who I realized a lot of their suffering was remediable. So actually, when I started taking care of them, I thought it was quite hopeless. And as I got to know them and understand their stories, I learned about my own bias and I wanted to share that with the committee. Fast forward, I moved to Ontario and MAID becomes legal in 2016. I still take care of marginalized patients just because of what I did in Montreal. I take care of a lot of people with disabilities, chronic pain, mental health addictions. I take care of a lot of refugees. And I take care of a lot of men, mostly men, but also women who've been in prison or are facing charges. So I take care of people with a lot of barriers, societal barriers to thriving, and became very concerned when I started to realize that our legislation is constructed in such a way that they can get medical assistance in dying for their life suffering when they can't access care and services they need.
So that's terrifying, because at the basis of what Canadian healthcare has been built around for decades has always been the idea that we are the gold standard, that we are the ones for the world to model off of, the socialized healthcare system where you, just like I was just doing a podcast with another individual before you who was American, who said, well, at least, we don't go bankrupt in Canada. I said, yes, but you'll die on the waiting list. So it's a funding issue versus a population density versus a breakdown of a healthcare system, because we're no longer, at least from my experience, we're no longer putting in funding, support networks, and then during the Forgive me for YouTube's sake, we have to muddle words. So during the Schmovid time, we had a lot of healthcare practitioners forced out. We had a lot of people who were unwilling to participate in that situation. So we've now lost a lot of really incredible doctors, a lot of really incredible nurses, surgeons, and people who have left the country for other jobs, other places because they didn't feel comfortable working in the system anymore. So now we're in this what feels like a population density overwhelm and a lack of funding, lack of care, and lack of support. And then this is where MAID comes in. And to me, people will say I'm more conspiratorial than you. You're a little more grounded, but I'm a little more, well, feels like the timing isn't coincidental. So when we look at 2016, when the Carter versus Canada case happened out in British Columbia, where I live, this is where the Supreme Court ruled that a doctor should have the right to help end the life of a patient through what was it? It was Bill C7, I think it was at the time.
14.
14. And they were able to then basically say, well, the doctor's not going to go to prison. They're going to be allowed to assist in the death. Now, initially, because you've had the experiences you've had, is this something that you supported off the bat, or is this something that you could see being utilized in a more later on abused in the system?
I think I've always had concerns about a policy that would allow a certain group of people to end the lives of other people. Coming
Mhm.
from like a racialized background, just my own personal life
Okay.
experience, where was always made to feel very other, and
Really?
very much so. It could be my own sensitivities. I was highly bullied in school. I wasn't just the only brown girl. I was also like
Okay.
obese, and
Okay.
I'm legally blind, and it was
Perfect.
yeah. So I just I grew up feeling very welcome in my home and not very welcome in a lot of places,
Okay.
and and so I think actually also when I started caring for these patients, which luckily was before the time of MAID,
Okay.
because, you know, part of the messaging and the teaching and our learnings come from our environment. So it was before the time of MAID where I worked around many doctors who had perspective, had hope, would give people time to
Mhm.
recover, would accompany them. It helped me to learn a lot of things so that by the time MAID was being proposed, I could already see that, you know, there's a very high level of depression when you have a new cancer
Mm.
diagnosis. Um, you can frame it as compassion and choice, but I already understood the kind of discrimination, well, first of all, that I had experienced as a child, so maybe I could see it more easily, but that I was
Right.
seeing in my patients who were older or severely disabled or disfigured, that they were
Mhm.
not treated the same way by the hospital system. I had a patient who had a muscular dystrophy who I adored in his 40s, and he was really sick. I sent him to the hospital, and I had called my husband to try to help him because he was sitting in the emerge. And my husband told me, and so did the patient, that like two different attendings were fighting about who would have to admit him. They didn't want to admit him,
Oh.
and even though he needed care. And that's the kind of treatment that I have seen of my patients. Physicians, we have our biases.
Yeah.
We carry a lot of the same biases that society carries, and that's
Yeah.
well documented in the literature. So the idea that you would give a group of people indiscriminately the power to choose when to end life and to be making
Mm.
that judgment about whose life is no longer worth living, and to give it to
Mhm.
all clinicians and nurse practitioners with who don't have expertise necessarily in chronic care, it's extremely dangerous.
I'm really glad that you brought that up. I think it's really important to discuss human biases because we're all different. We all have differing lived experiences. When you say brown, I don't want to make a judgment call. Indian?
Yeah,
Are you
indeed.
talking? Okay. Hey, I gotta ask. You never know because
Of
I
course.
use the well because of my lived experience. When I use the word brown, I'm thinking Afghani, Pakistani, Iraqi, Iranian. That's because
Oh, yeah.
that's how. Yeah.
Yeah.
Well, I mean, we're all brown, but you know, get my point. So
Yeah.
I think it's important to talk about human biases because based on lived experience, based on how you're raised, like you just said, it's going to be the opinion you have. And whether it's, you know, good for society or bad for society, that allows for people to feel a certain type of way. And based on that, you're going to have issues. A great example, very silly example, but a great example this week was there's been two doctors in America recently decided, I don't know why they do this because it never goes well. They decided to publicly go on social media platforms and hope that the presidential, what is her name? The speaker on behalf of Donald Trump, when she goes into labor, that she tears her body open and that she goes through excruciating pain. Those doctors have since been fired. There's also been doctors who have come up and said that they won't treat a Republican or a conservative for anesthesia because of their biases. We saw this in Canada during Schmovid time. There were a significant amount of doctors. A great example is Danielle Smith's amazing intern public health, who has been mating people since 2016, discussed how most people, if they haven't had the Schmovid thing, sorry, it sounds so silly. I have to say it that way. It's just YouTube. That they shouldn't be admitted and their children shouldn't get to see doctors. So human biases exist. And this, I think, is where my issues lie, around the idea that we can give people who have a more uh, quick to quit ideology to get to make our legislation, and who don't believe that anybody should suffer. And I personally have been through a lot of suffering, which sounds like you have as well in your life. And I believe that there is a lot to be learned in suffering, and that you have never been promised your whole life when you were born that you would be devoid of suffering. And I think there are lessons in suffering when they're managed properly. So when human biases come into place and we put things into law that give a blanket statement, and for individuals to potentially be coerced or manipulated into decision making because of lack of care, lack of support, and lack of a society that accepts them based on a narrative that has been propagandized over a long period of time, it makes me nervous. It makes me unsettled. And every time I go in for an operation or to see a doctor or an ER, I'm personally quite uncomfortable all of the time now. So, when you're going through this as a physician, is this something you're seeing, whether it's medical hesitancy, whether it's your patients who are more marginalized? Are they unwilling to maybe discuss some of their ailments and injuries because they're worried they're going to be offered MAID?
Yeah, so I think the disability community themselves have very clearly voiced some of the same concerns as you, Kelsey. Like even
Mhm.
before the time of MAID, um, going to the hospital when you're sick and vulnerable and being suggested to have a DNR, or that maybe you could just forego the antibiotics and it would be better for be better for you, wouldn't you want to be dead when you're very vulnerable, can make going into the medical system already very challenging for this community. The
Mhm.
UN has recognized that people with disabilities, who the MAID program targets de facto, you have to have a disability, a grievous and irremediable condition, to qualify, do not have their needs met. And now I have patients who are offered MAID. I've had a handful of patients, but it's also been in the media, where they've been offered MAID many times
Yeah.
during an admission, or just to have someone come to the home to discuss MAID with them when they haven't asked for it. Um, because the law says that you can, as part of informed consent, let people know that this is their right if you think it aligns with their values. Um, and so you could have people. I know a gentleman whose sister told me that he was offered MAID every day while he was in the hospital. Um,
Mm.
and they told him that, palliative care, you could accept palliative care, but we don't know how your course will go. But if you get MAID, this will be 100% certain. So painting it to patients as like a better choice,
Mm.
seeing certain patients as who, wanting to be compassionate and ending their lives, when actually a lot of their suffering is remediable, but not seeing that because you don't have the expertise necessarily
Right.
to realize.
Well, and I'm glad you brought up the expertise conversation, because it does feel like in just very recent medical history, we started to acknowledge the mind and the body are very connected. Yes, shocker, mind and body, amazing how one work together. But we understand things like depression, when I was diagnosed with post-traumatic, here's my list, ready? Post-traumatic stress disorder, traumatic brain injury, hearing loss, a treatment-resistant depression. These are all labels that potentially, due to my physical injury and then my mental health injuries due to war, qualify me. Now, when it comes to things like treatment resistant depression, Health Canada's solution is still electroshock therapy in 2025 and 2026. And what scares me about these things is I've had clients come to me, you've had patients, I know for a fact in the medical system say, nobody wants electroshock therapy. That is a very draconian way of treating things like depression. And it doesn't work, frankly. I've never seen a patient have it work well. But what I have seen work really well is things like change in diet, radical changes in diet, flipping from, processed food to more of a vegetable and meat diet, because 90% of that serotonin comes from your gut lining. And then when you have actual care, actual community, actual support, people who want to see you thrive, and then you potentially go outside the system and look at more holistic ways of healing, there is a lot of hope for people that I'm very concerned about. Once track 2 was already a problem, but now with the expansion in March of 2027, really quite concerned about the mental health community, because we have broken the mental health state of the country over the past 4 to 5 years. We have put individuals into isolation. We have removed community. We have removed the idea of hospice and palliative care, and we have removed support networks, which were otherwise funded by the government. And now the solution, apparently, as it walks in, is to just euthanize you because you're struggling. So when you're looking at this as a physician, how are you coping with this personally? Because my answer to people has always been this: if they're not asking about your sleep, your diet, your movement, your community, and your isolation issues, they're a drug dealer.
Yeah, I agree with you that a lot of medicine or medical practitioners can ignore total pain.
Yeah.
And they can ignore holistic approaches, which are very important. Like I've had patients who had, severe psychiatric diagnoses, and we cut out like excessive like caffeine and energy drinks and move to unprocessed food and work on sleep and exercise.
Yeah.
And then they've been stable for years. I do have some patients who've done very well with ECT, who
Yep.
before that had been in hospital for years. So I can't say that, but I've had some patients who've had like memory loss with ECT and as well. So I understand that people can feel, and I don't think like we understand enough to understand who benefits from what necessarily. Like a lot of things are still trial and error, but I totally agree with you that there's like a lot of missing things about lifestyle and approach in medicine that are severely lacking. Like people come in to see their, and just my sister is a psychiatrist, like, and she does OHIP covered, so government covered psychotherapy with my patients because they can't afford psychotherapy. But a lot of patients who can't afford psychotherapy, for example, in Ontario, and have a psychiatrist, and I understand this is not the role necessarily of psychiatry, it should be psychology, but most of them have like a 15 or 20-minute appointment with their psychiatrist where their meds are evaluated, new meds are given, and that's their appointment. That cannot be the kind of care that we're offering people while the same community is offering them medical assistance in dying. Is just such a shame, right? The government does not fund chronic care, doesn't fund psychology, doesn't fund dietitians. It's very hard to get access to the services, especially for my patients who might have live in lower socioeconomic states. It's a real struggle for them to get that kind of support. And actually, they're the ones actually who tend to not have the education and need it.
Yeah.
And yet, those same people, because the reason I got involved with this is that I realized, oh, shysters, sorry.
You can swear as much as you want on this show, love.
I was like, oh my gosh, these people. Some practitioners will offer them MAID, some won't.
Yeah.
Like a lot of doctors still are focused on care and recovery. A very small percentage of Canadian doctors are doing MAID, but I think the problem is that you can just get funneled if you're very unwell
Mhm.
And if you're desperate and want MAID, you can just keep calling back, as we've seen in several public cases that have been
Mhm.
reported in the New York Times. Katie Engelhart did a story on this. And just yesterday, Rupa from the Free Press
Yep.
reported on young Keanu's
Yeah.
death
Piano story.
with Ellen Wiebe, who initially was approved and then it was removed in 2022, I believe.
Yep.
And we
2022, 2023, and then got reapproved and then killed on December, was it December 30th of last year?
yeah, so like he could fly to BC when he's had, it sounds to me like a relapse. Like in the
Yep.
meantime, his mother had got him a place. He was doing
Mhm.
better. He was talking about the future. Then he has again a relapse, and then he can
Mhm.
go and get MAID from somebody else. So even though there are few or MAID practitioners, you just need to have a few of them that have a very lax approach, and you can just continue trying until you find that one
Right.
who, instead of saying like, no, there's solutions for you, saying this is exactly what you need and agreeing
Mhm.
and ending your life.
You know, the one that so two things. I'm going to push on one subject because this is where my brain goes. Uh I would always suggest before ECT on any platform in any way, shape, or form is regulated forms of psilocybin. We have an incredible amount of data and research around the prefrontal cortex and around what it does for the frontal lobe and regrowth and the nerve growth factor of the brains around depression management and treatment resistant patients. I'm a part of the special access program of Health Canada, and I was given granted access using regulated psilocybin. And I have gone completely into remission with depression, and I suffered for 15 years and was on 11 different pharmaceutical drugs because of it. Um, I always suggest taking a look outside, and my personal perspective is always if the doctor won't help you heal before you go do something with irreversible damage that we cannot control that fries your brain, please go try something else. And if that even means leaving the country, please go try to save your brain before it gets fried. Health Canada offered me ECT knowing I had a traumatic brain injury before they would give me access to a regulated mushroom. That's insanity. And so the research we're seeing from Johns Hopkins and University Imperial School of London around research around the brain healing from depression management and leaky gut and looking at the gut health in general around severe depression is wild. Even schizophrenia and bipolar 2 is insane when we utilize things like lion's mane, which is a non-psychoactive, completely legal functional mushroom, as well as psychoactive compounds within other other different psychedelics, which Therasil is a great advocate within the Canadian government. They're separate from Health Canada, but they advise Health Canada and doctors on how to get into the protocols so they can utilize it. I am not a fan of ketamine. I'm very clear to state that it's highly addictive and it does not do necessarily what it says to do, but psilocybin can in one single treatment. So those are always my suggestions personally. When it comes to talking about Keanu story, that one was very uncomfortable for me for several reasons. His mother reached out to me before he died and asking for help, and I did not see the message in time. That to me is always a rough one because it's not the first one, but is always a very hard one because of the ailments he had. Being a addiction psychedelic integration specialist, these are the people I work with before they go into the MAID system. And I know for a fact that people can be helped. But when doctors, I have such a hard time calling her a doctor. I'm quite okay calling her a serial killer. I have real issues with Ellen Wiebe for several reasons. One being involved in a case that is now in the courts, the BC court systems that came out some years ago. We were in contact at that time where we got the court injunction, where the BC courts stopped her from mating another individual, and she had akathisia. She reached out because she knew that I knew Jordan Peterson, and she wanted to speak to Jordan about akathisia and how she could heal from it. But she also had bipolar cycling too. And Ellen approved her over one Zoom call with seeing no medical records. And she was flying out to BC as well because she could not get mated in her province. And Ellen Wiebe approved her over a Zoom call with her common law partner sitting right there. And he was bear witness to all of that. So Ellen has a pattern. And this is me saying it, not you. Ellen Wiebe has a pattern of euthanizing people who don't necessarily qualify, who have been told no by other doctors in the nation, and somehow seems to get through with it at the Willow Clinic in Vancouver. And I'm not understanding how. Since then, Keanu's mother has started a petition with almost 11,000 signatures to have her license looked at a bare minimum. And to go much further, frankly, she wants to see Ellen in prison, and so do I. Ellen stopped stating the amount of people she's euthanized in the National Post, and has left the number at 400. And myself and another one of our mutual friends have been in the room where she's admitted to over 1,000. So out of the MAID practitioners in the country, which are run under CanMap and Dr. Stephanie Green, which is another very dark individual. Again, these are all my personal opinions. She has a tendency to run her mouth and has now been the person and the organization advising not only Canada, but the NIH on the non-FDA approved drugs for killing, which again, non-FDA approved. And that is the protocol they're utilizing. Now, when we're, sorry.
No, I was going to say, like, just a few things. One is that I'm so glad that your treatments worked for you. I am definitely not up to date with the evidence, so can't comment on, but
I would love to send some of it to you, because I think you would just be interested. If you're more of a holistic, I think it would just be cool to see how far we've come. And none of that has come from Canada. I testified at the emerging treatments for psychedelics in the parliament, for psychedelics for emerging treatments for first responders and veterans around PTSD treatments. And they did rule that emergency funding needed to be put into the research. Harvard, Johns Hopkins, and Imperial School of London have done some incredible studies, partnering with Heroic Hearts Project, which is a special operation funded nonprofit in America, as well as Ibogaine, which you're kind of seeing in the media now a little bit, where we have seen people go into full remission outside of like considered terminal post-traumatic stress disorder who were medically released due to that. And so whether it's me, whether it's other people, there is definitely a lot more research to be looked into here. And I'm hopeful that Canada will start giving more options outside of just medical interventions, but maybe more of these interventions that could save lives, because they're also really great for end-of-life treatment. Psilocybin for end-of-life treatment helps ease end-of-life anxieties and really help individuals move through the next step of life through palliative and hospice care. So I'm quite excited about that. But what was the other one? What was the other one?
I was going to say, for Ellen Wiebe, I think many people would agree that she is really kind of practicing at the edges of the law. Yeah. She said so herself, I believe, I can't remember which interview she said, but she's like, I'm the person who does the cases that my confers or other people don't feel comfortable doing. Mm-hmm. So she's actually put herself out there.
Hey, let me interrupt you for 10 seconds, because this actually matters. You can eat clean, train hard, you can meditate daily, and still feel like garbage if your body is overloaded with toxins. Modern life is loaded with heavy metals, microplastics, and those sticky, stubborn, forever chemicals. This stuff builds up quietly time over time and shows up as fatigue, brain fog, inflammation, and gut issues, and even poor sleep. The constant sense of being off, even when you're doing everything right. That's why I want to tell you guys about my new partners, Masterpiece by Human Consciousness Support. Masterpiece isn't some trendy detox gimmick or harsh cleanse. You guys know I do not do those. It's a scientifically formulated detox support made with microscopic organic zeolite, one of the most powerful binders, combined with bioavailable sea plasma minerals. And in plain, simple language, it basically helps your body bind to toxins, move them out safely, and replenish essential minerals inside instead of depleting you. This isn't about masking symptoms anymore or chasing those quick fixes. It's about reducing the toxic load in your body so that your nervous system, your brain, and your energy can actually function the way it's supposed to. People using Masterpiece report clearer thinking, better energy, improved digestion, and noticeably sense of calm internally. This isn't hype. It's not some miracle. It's just real changes that add up over time. So if you guys are serious about your health, which I know you are if you're listening to this show, then go and grab a bottle. And once you grab a bottle, it'll come with an extra one. In a world that's getting more toxic, and definitely not less, this one is worth your attention. The link is in the bio with the code. It's just Kelsi. Give it a shot. Hey everyone, there was a point when I realized I wasn't burnt out. I was just depleted. Not emotionally, not physically. I was just training and working and thinking constantly, writing for this show, and replacing it all with caffeine and grit. And what changed things for me was fixing the basics. Great hydration, real minerals, and support for my nervous system instead of the constant stimulus. Good Livin's electrolyte mix covers all of what most brands and people are missing, whether it's creatine, cordyceps, sea salt, potassium, magnesium, and thankfully, no added sugar, in ratios that actually make sense for the body. And their functional mushrooms help with focus and stress without flipping your nervous system into fight or flight. It's not exciting, it's effective. I don't use wellness products, but Good Livin' earned a spot in my daily stack, and I will never live without it again. If you want to feel more stable instead of more hyped, well, the link is in the show notes. Give them a shot. I promise you won't regret it. Yeah. So when we're discussing some of these things that we're seeing, though, because like you said, Ellen Wiebe is everything that I kind of report on her is self-admitted, because this is where the egotistical side of taking life kind of kicks in, where some people do it one time and they never want to do it again. Some people bear witness to it and never want to participate again. And then there are people who have reported, Dr. Christopher Line did a great paper in York, from York University, about healthcare serial killers, where people have admitted, feel these feelings of erotic feelings after, euphoria feelings after. These are, humans are going to go through different gamuts of emotion, but you don't know until you've done it where you stand. And that's kind of the issue I see, is we kind of open the door to killing. And once you open the door, we don't get to decide what walks through, whether that's legislation, whether that's individuals, whether that's feelings behind practitioners and where they come from and how they stand on it, whether they enjoy it, whether they enjoy the money from it, whether they enjoy just it's an easier patient because there's no follow up and the dead don't complain. So there's a lot of feelings around it. But when we're starting to look at the particular case that I would love to discuss, the Ontario Coroner Report, and I know there's going to be more coming out on the Ontario MAID Death Review Committee, but there was a report that you have put out and participated in and discussed, and that is the one that's kind of going viral right now. And I'm so glad that you did, because we cannot keep saying that this is compassionate and empathetic and it goes peacefully and perfectly, because it doesn't. There are cases of potential coercion and manipulation, as well as lack of care, which then funnels you into, like you said, a place where you have no other choice. So do you want to discuss with me, or can you discuss with me, Mrs. B,
Yeah,
the
sure.
80-year-old, please?
Yeah, of course. I'll just say that the chief coroner of Ontario, like every
Mhm.
province is different. So the chief coroner of Ontario was legislated to have oversight over MAID, and he takes his job very seriously. He has a MAID review team of specialized nurses who review the cases, and so actually, there in 2025 we were convened, a group of us, to look at certain cases that they had selected for our expertise, to comment on in terms of improving MAID practice or recommendations to the government. And there have been multiple reports. The first reports came out, it must be 2024, right?
Yep,
'Cause it's
the
been
2024 committee
yeah.
report.
So when we convened together, the first reports came out, we're on track 2.
Mhm.
And that was at the end of 2024, and then in the spring or the beginning of 2025 is when the report of Mrs. B came out,
Mhm.
that has gone viral now, but that was released last year. And so the first ones, like I said, in the fall, were on track 2. So you would see a lot of there was a whole section on people who have serious mental health issues, and some of them unaddressed, who have gotten MAID, or people
Mhm.
who have kind of financial or housing constraints or are lonely. They do have a disability, but really the drivers of their suffering are
Right.
things that I would consider remediable. So those are the first set of reports. And then the second set of reports that came out, the ones that have gone viral, and I think that has to do with the fact that they're for reasonably foreseeable natural death, and the UK
Mhm.
is currently thinking about legislating, are cases of same day or next day medical assistance in dying, meaning the day that you thought to ask it. If 2 assessors are available, you could end your life that day under our current legislation.
Okay, so I need to interrupt you just for 2.5 seconds,
Sorry.
because now the show has heard it from other people. There are same day maids. I'm not a lunatic. Dying with Dignity says that nobody at all, Ramona, has ever been approved with an underlying factor of financial issues or disability. That is their claim that
Yeah.
they apparently, them and
They're
Made
very
in
careful
Canada.
about their language, right? They say that
Yeah,
no one can be approved on that basis alone.
alone.
Tanya Tretton, who was the president of CAMUP, actually currently it's Julie Campbell. Initially it was Stephanie Green, so we're moving along. But when uh,
Probably for the best.
Tanya Tretton was president, but she had said in an interview with Megan Gilmore, she'd actually clarified that the suffering does not need to be tied to the disability, and that she was aware of some of the cases that were happening. This is before. But then when the
Right.
2024 report came out, you have a gentleman, and I've shared write-ups that you can share with
Mhm.
people too. They're public, and they have links to the actual reports. But there was a gentleman who had inflammatory bowel disease, but he had mental health issues and addictions. His family doctor sends him to a psychiatrist who mentions to him that actually he would qualify for MAID. And that starts him thinking about MAID, and his MAID journey ends with the MAID practitioner driving him to the place where his life was ended. So there's the question of voluntariness. Could that have put pressure on him? Both the psychiatrist suggesting it to him or raising it to him, and the MAID practitioner driving him there. He still had his mental health and addictions largely untreated. These are part of the case details that were released. The second case is a lady who had multiple chemical sensitivities,
Yes.
and she chose MAID because of her housing solution that she was given still made her very lonely, very isolated. She felt that she couldn't leave, and she didn't feel like she could have housing. And there was a Quebec group, there's a Quebec advocacy group for multiple chemical sensitivities that had been advocating for her to maybe have a trailer in the countryside where
Yeah.
be able to get out. But she received MAID before that could happen. And then there's several cases, like there's a gentleman who has COVID vaccines, I believe,
Yeah.
who has a history of mental health drivers before and after,
Mhm.
who got MAID, and the postmortem didn't show, I think, any abnormalities.
Yeah.
So you see those kinds of cases that while they say they're not happening, or they're saying they can't happen alone, so they're implying that there has to be a disability. But basically, it's if you have a disability and you're getting qualified for that, I don't think that that's what the law was meant to do, and it has happened. And then same day MAID, actually, we have a report, so it's public. It's not my report, and I should say these are all my own personal views. But the
Of
Chief
course.
Coroner of Ontario has these reports that he's released, and they actually show the numbers of same day or next day MAID.
I
And
need
actually,
that.
where I practice, so it's in the link that I shared to you.
Perfect.
But basically, where I practice, I think has the highest rate of same day, next day MAID in the province, which is probably why I've heard these stories through family
Yeah.
and patients before. So you can see there's regional variation, but what concerns me about same day or next day MAID is how do you do it an in-depth discovery about suffering? How do you attempt to remediate suffering? How could you even know the whole story
Right.
in the same day? And some of those cases, which Mrs. B, which you're saying has gone viral, come from that report. So Mrs. B had an operation. It looked like she was towards the end of her life, so she opted for, and I mean end of life in the broad sense, like not weeks
Mhm.
potentially, but so she opts for palliative care. Along the way, apparently a MAID request was made,
Yeah.
and so a MAID assessor comes to see her, but very quickly it's clear that she wants to die of palliative care
Yeah.
for personal and religious reasons. So the MAID so that ends that assessment. The next day, her husband, who's documented as having caregiver burnout, takes her to the emergency room, and they're sent home. And he
Mhm.
tries to contact through the palliative care doctor at home, I think hospice, but is declined as she doesn't fit the eligibility. And we could speak about eligibility of palliative care, but you have to have a short timeline. So, for example, my father
Yes.
didn't, even though, because he had dementia,
Okay.
when we tried to get palliative care in the home, we were declined in January, even though he actually
Mm.
died in March. We were told he's too well. So anyway,
Can
she was
I?
declined palliative care.
Right.
And so he called, the husband called the MAID care coordination service, which
Mm-hmm.
sent out another MAID assessor who did deem that it was urgent. He contacted the first MAID assessor who questioned the urgency, raised the
Mm-hmm.
caregiver burnout, raised that just the day before she had said that, she had wanted palliative care for personal and religious reasons, and
Mm-hmm.
asked because of the to get back involved and to come back another day, not that day. And the MAID assessor said, no, it's urgent, called the care coordination system, and
Okay.
another MAID assessor was brought in, and her life was ended that day itself. And there's other cases that are documented that haven't gone viral, but I think are just as
Yes.
concerning. There's a gentleman who made MAID inquiries, meaning he was interested in MAID. He hadn't
Yep.
had assessments, but he approaching the end of his life became delirious. So meaning he would
Mm-hmm.
not have had, as documented by the treating team. And so the decision was made to transfer him to hospice care. His substitute decision maker agreed. MAID assessor shows up. The treating team did tell him that they thought the patient did not have capacity and was delirious.
Mm-hmm.
The assessor rouses him to see if he can be made alert, withholds his meds to see if he'll come to, and accepts, nods, mouthing yes, I think hand squeezing, as signs of capacity and qualifying for MAID. And then that MAID assessor facilitates a second virtual assessment,
Mm.
and and that gentleman's life is ended through MAID. So the question, I mean, in both those cases is like, could there have been undue influence to die? For Mrs. B, as she's called in that report, like, I'm not saying that her, like, I saw some of the things in Twitter, like this horrible husband who, but
Yeah.
it could also be, and it's still not okay. It could be that he was absolutely burnt out, and because she loved him, she thought it was just the best thing to do to have made, right? This is all
Of
speculation,
course.
right? We don't know actually, because we only know what's been
Right.
documented. But one could also easily see that her decision making could be compromised
Mm-hmm.
because her and her husband together were not offered the services they needed to actually die at home.
Exactly. She was not given any sort of supports or care, nor were the husband when he pleaded for them. So,
No,
of course, if you're with someone and you love them, you don't want to become a burden. And that's also my problem and my worry is when you're in that state, because I have been in active suicidality for a good decade, you're not thinking clearly enough. Your cortisol is spiking, your tunnel vision. You sometimes cannot think past the day or the week or even the month. And then you look at those around you and you feel like a burden on the people around you. You feel like you're dragging them down and harming their life by being sick. So you come up with the story in your head that maybe it's easier if I die. So we don't know where her head was at in that time. But I do worry that that is also a contributing factor because we've had the case in British Columbia in 2023 in June, where a person had gone in with active suicidality and suicidal thoughts who asked for help and was offered MAID. So there's always going to be the human bias again. And we don't know if this woman, Mrs. B, was wanting to give her husband. He probably could have seen it. It probably was over a decent amount of time. That's exhausting. And you don't want to make anybody else suffer. But does that make it right that she was not given proper care and was offered death instead?
no, there's a few things I like to say. Like the Health Canada
Okay.
report actually also echoes that a lot of suffering driving death requests
Mm-hmm.
is the fear or feeling like of being a burden. And the second
Mm-hmm.
thing is that the Canadian Association of Suicide Prevention actually released a statement, it must be in 2020, in
Mm-hmm.
anticipation of the expansion of MAID with Bill C7. Um,
Mm-hmm.
they wrote a statement, and one of the things that they say is that we can create a society where there is actually a duty to die, where
Yeah.
we, instead of telling people that those thoughts, they can let go of those thoughts, they're not a burden, that we're a community, we're going to take care
Yes.
of you. Instead, we can reinforce this messaging that actually you are a burden and it is your duty to die. And the third thing I want to share is about my dad. I've shared in
Yes.
a different podcast in the UK, but when my father died in March of 2025. And I'm a doctor. My sister's a doctor and my husband's a doctor. So
Overachieving
very
family.
lucky, right? We're lucky in the sense that we have access to medical services.
Mhm.
But I found it challenging. Like, okay, first of all, it's a very stressful time, right? I'm losing my dad, who's like the most important person in my life. And I don't need to, I shouldn't have to be the doctor role, right?
Right.
In January, like when I told home care services, like he's been admitted, he's hardly eating now. It was funny because my dad is a very like high performer. So even though he was like, he had lost so much weight, he still came and like sat with the person who was assessing him. And even though if you actually paid attention, he didn't have more than 15 seconds of attention span. Um,
Oh,
that person missed it. And they're like, he seems like he's way too high functioning for palliative care. Anyways,
yeah.
so then alone, me and my husband and my mother, which we are taking care of my dad as he's getting worse and worse, and he's in and out of the hospital. And then finally, it's the end. In March,
Yeah.
one day he wakes up and he is groaning and in pain. And I had at this point, a week before, been allowed, like they had realized, okay, yes, he is dying. They let me fill in the palliative care forms.
Mm.
And the plan is that when I need them, I'm going to call them. So
Right.
I call them. And they're like, yeah, we don't actually have a record of those forms you filled, and we'll get back to you. And then a nurse calls me and she said, you know what? You should just go to the hospital. Let him die at the hospital. We don't have your forms. And I hang up the phone and I was like, okay. My dad is like writhing in pain and we'd
Yeah,
have to
he's
take him
active
to him.
dying now.
And my husband's like, just call them back. Tell them it's not acceptable. So I call them back and I reach somebody else who's like, you know what? She shouldn't have done that. It's true. We can't find the forms, but we're going to send somebody. And
Yeah.
that's good because I have the carbon copy of the forms.
I have them right here. Yeah.
So they come to our house. Guess what? So we didn't fill the forms. Someone from their team filled the forms. They were filled incorrectly.
Oh,
So
lovely.
no kit is available for my dad. Like no drugs are readily available. Anyways, they were very nice. The care team that came out were super nice.
Right.
And they were distressed. But the thing is, they're like, well, without a treating doctor on this paper, he
Right.
can't get palliative care at home. So second time, like, okay, well, so guess what? We're doctors. So we call
Yeah.
call his doctor on his cell who's on vacation so that he gives
Perfect.
verbal orders and agrees. But no one else
Yeah.
would have that opportunity.
Nope.
No one else. My dad, so second opportunity, my dad would have had to go into the hospital to die in pain. And then finally we get the meds. And that night they run out of meds, pain meds. And
Oh, for
they don't
God's
have a
sake.
nighttime pharmacy in our area to supply extra meds, and they hadn't planned for his pain to be so bad. And so like a lot of these things are system errors. Like
Of course.
people involved were just beyond fabulous once we had them. My dad's family doctor, beyond fabulous. But it was those things at that time were so painful. They made it
Yeah.
so that I understand why people would want MAID.
Of
No,
course.
I don't think it's right, but I could understand how you could be so desperate
Yes.
that you're like, shit, the system doesn't work, and I
Yep.
just have the control. But is it right? No, like people have the right to have good palliative care. Mrs. B had
Yes.
the right. Like, why couldn't they urge if they could get urgent MAID, why couldn't they get urgent palliative care?
That's my point.
Yeah.
That's my point. That's my problem. That's my issue. And then the last issue, and I would love nothing more to have you back, please, because I think there's so much more to talk about. But all of my lovely listeners' attention spans cap at an hour. I love you guys, but we're gonna work on it. But I do. This is another point, and Dr. Joel Zivit's research around this was really solid. Is we can give pentobarbital to our dogs. We can use potassium chloride. We can use fentanyl. We can use morphine. Why are we using non-FDA approved drugs at high doses that have never been tested for killing and using a paralytic? I don't understand. So when Dying with Dignity makes these claims, or these organizations make these claims that things are peaceful, we have some very uncomfortable, very, very, very long deaths on record. And that's my issue is I don't believe this is informed consent in any way. I just don't at this point.
So like about Joel's work,
Mhm.
that's fine. And like I've been in touch with Joel's about as well. But
Yeah.
I think actually what's more important about informed consent is a good
Mhm.
point in general, is that when I was debating, I think it was Stephanie Green in Scottish Parliament, she had said like there's no problems with May deaths and all May deaths. I think she said that in Chatelaine
How do
recently.
you say it with a straight face is what I wanna know. I'm
Actually,
sorry.
there's a document produced by CAMAP that's public called Failed Made in the Community. And actually the chief coroner has a public report where, they talk about, failed intravenous access.
Yep.
You have emerge surveys where emerge physicians have reported patients ending up in emerge for failed MAID. Um, I had a family member's friend approach me who was involved in a MAID death where the person, after the MAID provider left, woke up and was gasping when they all went to hug them. So the thing is, we
Mhm.
know, like, maybe there's no public, easily accessible document, but we know that not every MAID death is perfect, that there can be problems, whether it's drug,
Right.
like whether it's site IV administration, whether it's an adverse reaction to the drug. I'm not even speaking to Joel's stuff because I don't have the expertise to, but
It's
even
okay, I do.
but even on those levels, we have
Yeah.
evidence that things are not always perfect. So
Right.
to tell, for example, that gentleman I was telling you who had a brain tumor who was told, like, we don't know how palliative care go, but MAID will be perfect and it'll be controlled. That's not actually fair. That's
Right.
not actually informed the information for someone to be able to have informed consent. I agree
Yeah.
with you on that point.
When we're looking at some of these other reports, so Mrs. B's report, like I said, has gone viral, and there is a million other, like, using the numbers, but there's a ton of other cases where there has been non-compliant deaths, over 400 of them in Ontario alone. There has been a lot in America right now that we're looking at that are really questionable at best, in terms of doctors using terms like in Colorado, using terms like terminal anorexia, which is not a medical term, nor is it in the DSM any way, shape, or form. It's a mental health disorder that can be cured. I've seen it. A lot of people have seen it. It's also a very well documented social contagion that, Abigail Schreier wrote about it in Irreversible Damage. You put a bunch of anorexics on a ward, you're going to see that. I've also gone through personal experience with family members with that. There's a lot of these things come back to mental health, lack of care, and lack of support. So when we're looking at moving forward, that we do have other cases that, when I have you back on, I would love to discuss. And I know they're going to be coming out. They are all public. So just for those that are listening, because I call them the enemy likes to listen to the show. Everything that you've stated is very public, very documented. It is all through the BMJ. It has all been looked at, gone through, whether that's with the Ontario Coroner reports or other reports. Everything you've
That
written
one,
about,
you're right. That will be coming out. The
yes, is coming out. Yeah.
DMJ, supportive care,
Mhm.
supportive palliative care paper is coming out in a few days.
Yes.
But the chief coroner reports are all public. He is making a
Yes.
website. He has released a document, a memorandum where he's announced the website that's going to be posted. So that's public news.
Yes.
He has said, um, in various things about the IV access and other stuff, but there's
Mhm.
other documentation that's all out as well. And the reports, they're all in those blogs that I've sent you that
Yes.
you can post.
And when this episode comes out, these will already be public. This episode, I believe, will be coming out next week. So these will already be public and data will be released. And there are other cases that, like I said, I do want to go through with you, of some of these when we have you on again, to kind of break down. And we'll just do case by case on the next episode, just so that we can give people an idea that this is not a one off. This is not, conspiracy. This is not us trying to remove people's rights. This is us standing up and saying there is something deeper going on here. And then, outside of where the medical system is failing, there is also a lot of conversations around organ donation, because there is a lot of coercion and conversations I'm having with family members who are being told it's fine if they have MAID, but they need to also agree to organ donation. Now, I don't know what your thoughts are on that, but I'd be curious to see, when somebody utilizes MAID, is organ donation mandatory if they're in the hospital?
So, as far as I know, organ donation is never mandatory, but the guidelines changed. So basically, it
Right.
used to be that to avoid influence to die, because imagine that you're suffering
Yes.
in any way,
Hmm.
existential or physical, and you have this idea that in fact you can give your organs to somebody else, could
Hmm.
actually incentivize or affect your freedom to choose freely to die or not, because it could actually push you towards MAID. So it
Hmm.
used to be that you had to agree to MAID before someone could actually raise and discuss organ donation with you to avoid that kind of undue influence. The newer guidelines suggest that organ donation should be brought up as soon as possible, and that people should be aware as soon as possible so that we can harvest uh, organs from as many people as we can. And I think, like, especially for mental illness, in 2027, which has been suspended until 2027,
Hmm.
just like imagine that you feel like you're a burden on society, you're lonely, you're isolated. I think being told that you could give someone else life, and I think organ
Hmm.
donation in principle is a very good thing, right? Like,
In practice lately, not so
yeah,
great.
yeah, I have some patients who've had heart transplants, lung
Mm.
transplants, um, really amazing, from people who've unfortunately died, like in motor vehicle accidents.
Right.
Um, and so I am a big supporter of organ donation when it's done ethically. I'm very,
Yeah.
very concerned about whether someone is freely, again, informed consent, freely giving their organs,
Hmm.
if potentially it affected their choice to die, like if it affected their freedom to choose, because it was incentivizing death for them.
I'm really glad that you brought that up because I think it's something right now we are seeing a massive uptick on. We have seen, I have affidavits and written statements from people who have been told that they can't have it unless they donate their organs, which is also, people can say that's unsubstantiated. Well, it's not law, but it doesn't mean it's not happening. Just like people say that they're, there's
Bad
gonna,
doctors, lots of bad doctors who sexually abuse their patients, right? Like,
right. Yeah.
I'm not.
There's actually, speaking of that, there's a great pediatrician in Alberta who's still practicing, who has multiple sexual assault cases on children, but somehow is still practicing. So, there's plenty of things. I actually have a client right now who's being sued by a doctor in Alberta. She reported for malpractice and is getting a lawsuit because she spoke about it on TikTok, but the doctor's not losing her license. So, there is always going to be these complicated situations where governing bodies are really the issue. It's no different than Jordan Peterson losing his license or having his license threatened for speaking on Joe Rogan. There's going to be biases in a lot of different areas, no matter what we do. And I think because humans are humans, you're never going to fully understand unless they outwardly say, this is what they want, this is why they're doing it. Um, just lastly, because you are so involved in this area of just trying to get people to see both sides of things, and you've had lived experience in both areas of the more vulnerable population, where do you want to see this go in the future in terms of maybe mental illness, mature minors, and what feels like this continued grasp towards ending lives of the vulnerable?
Well, many human rights groups, including the United Nations Conventions of Rights of Persons with Disabilities, ruled, I think in March of 2025,
Mhm.
that we should repeal Track 2, that we need oversight of Track 1, because we could like Mrs. B is a Track 1 case.
Yep.
There are, and provincially, yes, the chief coroner is doing something post-mortem, but we probably need oversight in real time. Asking me what I personally think, I don't think MAID will ever be safe. Like, so you can have safeguards to make it safer,
Right.
and given the political climate, um, I mean, I think I know many MAID assessors of
Yeah.
goodwill who also want MAID to be safer.
Yeah.
So I think that we have some common ground there. I think where we
Mhm.
don't have common ground is I think it shouldn't be legal. Like,
Yeah.
I don't see how.
Oh, that's where you and I agree, sweetheart. We were on common ground on that.
I've been pretty clear from the beginning that I don't think that you can have a program like this. Like there's a reason, and I'm not like I understand that there's some things we don't agree on, and that's okay. But like for example, like there's a reason, and I don't know where you stand on this, but there's a reason why I think capital punishment should be illegal, and why it is illegal, because it's problematic that you could have a wrongful death of an innocent person.
Oh, I fully agree.
Okay, I wasn't sure.
No. Listen, I don't
like. I respect people with different views who are listening.
My line is this: you touch kids, you go in a wood chipper. The rest of it is pretty simple.
I'm not saying, like, even if your listeners are for capital punishment, like I'm not trying to alienate anyone from the conversation. I'm just trying to say, like,
nobody's alienated here.
Okay, but basically, for MAID, we're seeming to tolerate what I consider to be wrongful deaths of innocent people who are at the margins of society, people who are already heavily discriminated against. And I understand that these are just a few cases that are public. We know from the disability community have raised many more cases. And the thing is, that's terrible. These are the people that we've neglected, that we have not taken care of, that we have failed to love. And now they're getting made through a government program. To me, that is like 100% not okay, and will never be okay for those people. And therefore, I don't think that this was a great program to be legalized. And like that's the kind of discussion that people will have when we think about what is right for the common good in terms of risks and benefits. But for me, it is safer to offer excellent palliative care to everybody and not have MAID. So, but in terms of what I think is workable I think there's a lot of common ground, even for people who might be for MAID for terminal illness, to try to have MAID be safer, at least in the interim.
I fully agree. I think the second that you say you want to qualify for terminal and you can just say a couple different words, like I'm no longer eating and drinking, and that all of a sudden moves you into a track one position, I think is a dangerous, unbelievably slippery slope.
I know that you want to talk about another time, but one of the cases that will come out in the BMJ piece is a gentleman who has cerebral palsy. So he's not dying, and then he stops and the question is, why does he stop eating and drinking? We can talk about next time, but he stops eating and drinking. And so he develops renal failure and dehydration, and he's approved for MAID as somebody whose death is reasonably foreseeable.
There it is right there. So, and that's my problem.
I have a lot of problems, but yes, that's one of my
problems. That's one of my, like, it's too simple. If you know how to work the system, Alicia Duncan's mother is a great example. You guys, my listeners have heard me speak about that. You know, when you know the system, you can work it. It's no different than friends of mine that work at the CRA. You know, when you know the system, you know how to work it. And that is always going to be the issues. I am truly sorry about your father having to go through that extreme pain when we can go get crack in vending machines outside of Toronto hospitals, but he couldn't get access to morphine at night or to fentanyl at night. That's disgusting and completely unacceptable. And I am sorry that your whole family had to go through that. But what I do think is really important to highlight is you have 3 doctors in your family who are medical professionals, and you still struggled to get support and help for your family and your loved ones. Now imagine the people who don't have family doctors, who frankly can't get access.
It's really terrible. Like I have to say, like, I'm very privileged, right?
But still, it doesn't matter, it seems.
You
know, trauma is pain.
To anybody, exactly. But I think it's much worse for other people, and I think that actually MAID is partly, like when you're saying, we always speculate about why MAID came into being, and if people are utilitarian, or if this is like eugenics, or if this was cost savings, or or if some people really did think that this is like a compassionate cultural response. But for the people who thought it was a compassionate cultural response, just in discussing with people, I think it's because they've seen deaths that shouldn't have been the way that they were. And I think that the solution should have been better palliative care, not MAID.
Right? And you couldn't be more wrong. Yeah, I know you couldn't be more right about that, hon. And that's exactly what it is. So, and saying that, if people wanted to find you on any social media platform where you maybe post your articles or some of these things that you do, report on, where could they support you there?
So I am a senior fellow of the Macdonald-Laurier Institute. So on their website, a lot of my articles are linked there. I've also recently joined X at
you have
Coelho.
Don't read the comments.
Oh yeah, okay. Okay, I will never. But yeah, I have I think I have 10 followers, and that's okay, because I'm just there to see what people are posting. But I'm going to be on there more. And but Macdonald-Laurier Institute has all of my writings.
Perfect. And I'll put everything in the show notes where everyone can find you and support you. And you have over 20
Oh,
now, by the way.
sorry?
You have over
20.
20.
And I wrote a book. So like if anyone's actually really interested on I co-edited a book with Truda Lemons, who's the bioethics chair at the University of Law in Toronto, at University of Toronto, and Dr. Sana Gained, also a professor of psychiatry at the University of Toronto. Our book is called Unraveling MAID in Canada. It's more of an academic read, but it has different people with different perspectives. So like an Indigenous leader, Gabrielle Peters, who's a disabled writer, different legal scholars, psychiatrists, Dr. Leonie Hertz, different people who present the medical, legal, and lived experience arguments that help explain what the dangers of MAID in Canada are.
I'm so grateful for your work and your continued efforts into this space. It does not go unseen, although I do know sometimes it feels that way, but I can promise you it's not. I'm just grateful that you're willing to speak about it so that people can learn from others that aren't just podcasters. So it's nice to have your perspective, and it is very welcomed here in our community. And I know it is very welcomed from people who have been in the process, because it helps them realize what they were thinking going through it. They're not wrong. They're not crazy. They're not lunatics. These things happen, and that there could be things that are going wrong. So I'm really grateful for that. So in the next steps, what we'll do is we'll jump off with you here. We'll put everything in the show notes, and then we'll schedule with you again here, hopefully in the next few weeks, where we can go into these cases a little bit deeper and really just break them down for the listeners. Sound good?
Sounds great. Thanks for having me.
Of course, sweetheart. All right, everyone, you stick with me. You know what to do. Subscribe. Go see everybody. You know all of the things. Go check them out in the bio. And I will see you guys all tomorrow. You stick with me.